What are mesothelioma biomarkers for early detection? Imagine catching a rare cancer like mesothelioma before it causes serious harm. That's where biomarkers come into play. Biomarkers are substances found in blood or other bodily fluids that can hint at the presence of disease. For mesothelioma, these markers are often proteins or genetic clues that can signal the cancer's early development. Since mesothelioma is usually linked to asbestos exposure and can take decades to show symptoms, early detection is key to improving outcomes. But it's important to remember that no single biomarker can definitively diagnose mesothelioma on its own. Instead, these markers are tools that help doctors identify those at higher risk or catch the disease earlier. One of the most studied biomarkers is soluble mesothelin-related peptide, or SMRP. This protein is produced in larger amounts by mesothelioma cells compared to normal cells. The Mesomark blood test measures SMRP levels and is approved by the Food and Drug Administration for monitoring patients with mesothelioma. However, its ability to detect the disease early is limited because elevated SMRP levels can sometimes be seen in other asbestos-related conditions. So, while helpful, it's not a perfect standalone test. Another biomarker is osteopontin, a protein that tends to be higher in mesothelioma patients. It can be useful when combined with other markers but isn't specific enough to confirm a diagnosis by itself. Researchers are also exploring fibrillin-3, a protein that shows promise in distinguishing mesothelioma from other diseases through simple blood tests. Calretinin, a calcium-binding protein, is often used in tissue staining but is also being studied in blood tests to improve early detection, especially in the epithelioid subtype of mesothelioma. High-mobility group box protein 1, or HMGB1, is involved in inflammation caused by asbestos exposure. Elevated levels might help identify individuals at risk before cancer develops. Additionally, mutations in the BAP1 gene, which is involved in tumor suppression, can serve as genetic markers indicating increased risk for mesothelioma. Emerging research is also looking into microRNA patterns, small RNA molecules that regulate gene activity, and volatile organic compounds in breath analysis. These non-invasive tests could someday allow for earlier detection without the need for invasive procedures. Other proteins like epidermal growth factor and estrogen receptor beta are being studied for their roles in certain mesothelioma types and could guide future diagnostics. While these biomarkers are promising, they are not yet definitive tools for diagnosis. Confirming mesothelioma still requires a tissue biopsy examined under a microscope. Biomarker testing works best when combined with clinical evaluation, imaging scans, and a detailed history of asbestos exposure. For those at risk, especially individuals with known exposure, regular screening with these tools may help catch the disease early and improve treatment options. Scientists continue to work on developing more sensitive and specific biomarker panels and non-invasive tests. The goal is to detect mesothelioma earlier, when treatment is more effective, and to save lives. If you have concerns about asbestos exposure or risk factors for mesothelioma, it's essential to consult healthcare professionals who can recommend personalized screening strategies. Remember, early detection can make a real difference, and ongoing research is bringing us closer to better tools for fighting this challenging disease.